A new study we talked about on Wednesday. It has a lot of pregnant women wondering if it's safe to get their annual flu shot. NBC medical contributor Dr. Natalie Azar is here to address the concerns. Natalie, good morning to you. What was the headline exactly, and can we take it at face value?
The headline is that flu vaccine in early pregnancy could increase the risk of miscarriage. So what this study was a case study from a couple of years ago. They followed pregnant women over 2 flu seasons. What they found was that women vaccinated early in pregnancy with this particular strain called the H1N1, you might remember that pandemic from a few years ago, who had also received the vaccine the year prior, where it increased risk for miscarriage 1 to 28 days after the vaccination. Now, to say from the outset, there was no way to quantify this risk, so they're not saying that there's an increased percentage probability of this happening. This was not a cause and effect. We talk about this often, that it's an association, a potential link, but does not prove causation. And in research, this is something called a safety signal. So it's not definitive. It's a finding that warrants further study and conversation.
Okay, and that's complicated, but let's bottom line it, because there are a lot of pregnant women who will be told by their doctors, go get your flu shot.
Okay.
Should they still do that, and when?
Yes. Okay, so affirmatively, CDC, which funded the study, as well as the American College of Obstetrics and Gynecologists, strongly continue to endorse the flu vaccine at any time during pregnancy. Previous, lots of data, former studies as well as ongoing studies have demonstrated the safety of the flu vaccine. And remember, too, that influenza, I should say, pregnant women are much more vulnerable to serious complications from influenza. And the best strategy for protecting your newborn is to have a vaccine during pregnancy, because infants can't get the vaccine until they are 6 months, 6 months of age.
So are there some long-term studies that are going to be going into effect now to see if there really is a link between these two?
There's an ongoing study right now that covers the seasons 2012 to 2015 that we'll be reporting on hopefully in 2018 and 2019. But again, the bottom line, based on all the previous, the vast literature, is that flu vaccine is not only recommended during pregnancy, but is safe during pregnancy.
And real quickly, taking it past pregnant women, flu vaccines are available right now. You recommend everybody get one? Everybody
who's a candidate for the flu vaccine should get the flu vaccine to create herd immunity to protect those who cannot get it.
'Tis the season now. That's important information. Thank you.
Thanks very much.